The Children's Hospital of San Antonio practices patient and family-centered care throughout the hospital. Patient and family-centered care is an approach to healthcare that establishes a partnership among healthcare providers, patients, and families. This healthcare model recognizes the vital role that patients and families play in the healthcare system and has become standard practice in medical care. Patient and family-centered care influences policies, programs, facility design, and all interactions in a healthcare system. Patient and family-centered care leads to better healthcare outcomes and wiser allocation of resources, as well as greater patient and family satisfaction. There are 4 core concepts of patient and family-centered care. Respect and dignity involves healthcare practitioners listening to and honoring patient and family perspectives and choices. Patient and family knowledge, values, beliefs, and cultural backgrounds are incorporated into the planning and delivery of care. Information sharing is when healthcare practitioners communicate and share complete and unbiased information with patients and families. Patients and families must receive timely, complete, and accurate information in order to effectively participate in care and decision making. Participation is the third core component. Patients and families are encouraged and supported in participating in care and in decision making at the level they choose. Finally, collaboration is when patients and families are included on an institutional-wide basis in hospital policies, healthcare facility design, professional education, and delivery of care. This approach to healthcare is the standard at the Children's Hospital of San Antonio. We have joined many of the top children's hospitals in North America as a pinwheel champion of the Institute for Patient and Family-Centered Care. Pinwheel champions are healthcare organizations dedicated to advancing the understanding and practice of patient and family-centered care. You can visit the Institute for Patient and Family-Centered Care website for more information and resources on family-centered care. One important aspect of patient and family-centered care during your inpatient rotation is family-centered rounds. Multidisciplinary family-centered rounds occurs at the bedside for all pediatric hospital medicine patients on the red and blue team. Formal rounds with various participants occurs Monday through Friday from 9:30 a.m. to 11:30 a.m. We conduct informal bedside rounds on the weekends with the bedside nurse and family. The red team starts rounds on the 7th floor, the IMC, and proceeds up to the 11th floor. The blue team starts rounds on the 11th floor and proceeds down to the 7th floor. Rounds are an important part of the day to discuss how each patient is doing and to determine the plan for the day with the family. Rounds last about 7 to 10 minutes in each patient room. The primary intern or 4th-year medical student for the patient will lead the presentation and discussion with the family. If there is a medical student on a core pediatric clerkship, he or she will begin the presentation and discussion with the intern providing assistance as needed. The main participants are the primary physicians, bedside nurse, and family. Case management, social work, and child life participate regularly. Additional departments such as pharmacy, respiratory therapy, nutrition, OT, PT, ST, and pastoral care participate if available. When you enter the room, first introduce key members of the team to the family. Invite the patient, if applicable, and family to participate throughout rounds. Always remember to sit down when you are presenting to the family. Finally, do not use any medical jargon when you are talking. Your entire presentation should use language that the family understands. This does not always come naturally and will take time to master. Your attending and fellow will role model how to present in this style. In order to have a standardized approach to oral presentations on rounds and deliver accurate and efficient patient presentations, we are providing the free TIPS tool, named after the acronym which it follows. This is a published and peer-reviewed tool on MedEd portal. Here is the inpatient rounding card for new patients to help you deliver a complete and organized presentation. During the events section, we ask the bedside nurse to provide any overnight or morning updates. This card is on Blackboard and in the PHM Resident Handbook. This is the inpatient rounding card for established patients. Once again, during the events section, we ask the bedside nurse to provide any overnight or morning updates. This card is also on Blackboard and in the PHM Resident Handbook. Finally, the published Free Tips Rounding module includes patient presentation examples using the Free Tips Rounding tool. There is a presentation example for both new and established patients on Blackboard and in the PHM Resident Handbook. Please review these rounding cards and presentation examples before the first day of your inpatient rotation.